Hi, I'm Dr. Chris Larson, and I created this video to explain how my direct primary care clinic works. It's called direct primary care because the patient pays directly for the care that they receive, as opposed to paying the insurance company that would then pay me. In this latter situation, the insurance company is a middleman, and as we all know, when a good or a service passes through the hands of a middleman, the price increases. Now, I've chosen this style of practice because it allows me to spend more time with my patients. It allows me to treat those that either have no insurance or have high deductible health insurance plans. And I think it's just a more sustainable way of practicing versus seeing 30 or more patients per day. And with that, let's start the video to explain how Austin Osteopathic Family Medicine works. I'm going to start by giving you an overview of the annual physical plan. Then I'll show you some of the detail of the plan, and finally I'll show you a financial comparison of an example patient at Austin Osteopathic Family Medicine versus another clinic. As a patient, you make a monthly payment that is based on your age. From 0 to 19 years of age, you pay $59 a month. From 20 to 39 years of age, you pay $69 a month. From 40 to 59 years of age, you pay $79 a month, and if you are 60 years or older, you pay $89 a month. For this monthly payment, you get your yearly physical exam. You get follow-up care for chronic diseases and sick visits at a reduced price of $20 per visit, and you get a higher level of service and communication compared to what you would receive at a doctor's office that takes insurance. This slide shows details of the annual physical. We'll complete a physical exam to check and make sure that everything is working as it should. If you have either risk factors or symptoms of a chronic disease, the labs to screen for the disease are included. Examples are screening for diabetes, high cholesterol, high or low thyroid function, cervical cancer screening for women, or prostate cancer screening for men. Routine labs for following a previously diagnosed chronic disease or condition are also included. And during the visit, we will also discuss other preventive measures that you may take to improve or protect your health, including lifestyle changes, immunizations, periodic screening for breast cancer or bone density, as well as medical advance directives. Additionally, if your symptoms require an EKG, it's included. In addition to the annual physical and labs, you get all of your follow-up and sick visits for $20 per visit. There is no extra cost for the routine labs that you might need for follow-up of chronic diseases or an illness. Also included are the most common in-clinic tests required for urgent visits like a strep test, a pregnancy test, a urinalysis for evaluation of a urinary tract infection, or a test to check your blood sugar. A flu test is available at an additional charge, but this charge is more than half off of what you would pay at other clinics. If you need an EKG at a sick visit, there is still no additional charge. Our clinic is set up to leave space in the schedule so that we can see you the same day that you call or the next day. You also get a level of service and communication that would be difficult to find at an office that accepts insurance. If you need to be seen for something outside of routine care like removal of an ingrown nail, or repairing a cut to your skin, this will be done at a discounted price compared to what you would pay at a traditional clinic. Our pricing is transparent and can be seen on the fees page of our website. We are able to conduct visits by phone or secure computer video conferencing when it's appropriate, and you can communicate with our office by email for things such as questions about medicines or labs, as well as management of chronic diseases. You will have access to a secure online health record through our patient portal on the website. Your medications, labs, and other health information will be available to you at all times. Given that many medical mistakes occur when care is transferred between multiple doctors, we make it a point to follow up with your specialists and to discuss your hospital discharge plan if you are ever in the hospital. Let's use an example to clarify how all of this works. Let's imagine a 38-year-old woman with high blood pressure and a history of thyroid abnormalities. With high blood pressure, your doctor should see you once per month until the blood pressure is controlled. Let's assume it takes 4 visits in order to accomplish this. A baseline EKG is suggested, as well as labs to screen for possible causes of high blood pressure or complications from high blood pressure. A couple of these labs, like the complete metabolic panel or microalbumin, would be needed more than once per year. With thyroid abnormalities, a patient would need to be seen every 6 weeks until the thyroid is controlled and stable. Let's assume 3 visits in order to accomplish this, and that some of these visits would be combined with the visits for high blood pressure. The labs to follow thyroid abnormalities and its treatment would need to be repeated throughout the year. As you can see, the labs that are required for thyroid issues are required for high blood pressure as well. We can use one lab to accomplish the same task for each condition. Basically, at your first visit, the TSH that we draw for your thyroid abnormality could be used in the discussion of high blood pressure as well. Let's also assume this young woman needs to be seen one time during the year for painful urination. And to assess this complaint, we would do an in-clinic analysis of her urine. This slide shows the cost comparison for the example patient. If she were to be a patient at our clinic versus being a patient at another traditional clinic. And the costs that you see are the charges for a cash pay patient that pays at the time of the visit. The first row shows the total costs for just the visits to the clinic to see the doctor. The second row shows the costs of labs associated with the visits. With our clinic, there are no additional costs for routine labs. The next row shows the cost for taking the blood for the lab work. You are able to see the cost of the EKG on the next row, and you guessed it, there are still no additional charges for an EKG at Austin Osteopathic Family Medicine. When you compare the total, you can see that from a financial standpoint, it makes sense to use a direct primary care clinic like Austin Osteopathic Family Medicine. From the standpoint of customer service, this clinic was created with the patient in mind. You can be seen the same day that you call or the next day. You can communicate with your doctor by phone, by email, or by video conference e-visit, and you can see the price before you come to the clinic. If you have any questions or you would like to come in for a visit, please call us or visit the registration page.